So welcome class. We have Dr. Edina Meetze with us today. She's a clinical assistant professor in health promotion, education, and behavior. I've asked her to come and talk with you today, and they're very excited about your presentation. Many of them are waiting to take information from you and put it right in their paper.
Oh, yay, yay.
So anyway, as you can tell, this is a new format for Dr. Meetze, even though she does quite a bit of in-person and online teaching. So I'm going to turn it over to you.
Well, thank you, and hello, everybody. This is really weird because I can kind of see myself. Oh, Lord,
I know.
that's even worse. But anyway, so I am, like Dr. Kinnison said, I am Edina Meetze. I am originally from Brazil. I've been in this country for a long time. I came here when I was 8 years old. Didn't speak English. When I came here, there wasn't a whole lot of Latinos in this area. But as in time, for those of you who are in South Carolina or in the Southeast, you know that the number of Latinos in this area has grown tremendously. And so it kind of opened up a, some duties and some responsibilities that I felt that I had as a Latina, and also living in South Carolina for such a long time. I kind of had the experience and the expertise of my state, but also have the background of being a Latino. So I kind of was, it's the best of both worlds, I felt. So with that, my area of research is around the Latino, the newly immigrated Latino into the Southeast and South Carolina. I do most of my work with HIV and STDs, but I've done some things working with Latinos to address other health issues outside of HIV and STDs, because there's really not that many Latinos here that, are here and are professional or have a degree and are able to do some of the things that those of us who have that can do. And so that's kind of a little bit of a barrier, but I'll talk about that in a little bit. So what I was asked to talk to you guys about was the Latino community in South Carolina, the challenges and the successes. And so I will start. Let me see if it's the little arrow here. All right, perfect. Okay, so as you can see here, there's no date on here. And sorry for that. I missed some of the dates because a lot of the data hasn't changed a lot. But in the United States, there's around 38 or less million Hispanics or Latinos in the U.S. What I want to say is the Latinos, Hispanics, a lot of times those words are used interchangeably. But I like the term Latinos. I am a Latina. I am not Hispanic because my first language is not Spanish. My first language is Portuguese. So the U.S. is the one that coined the term Hispanic to kind of refer to people who only speak Spanish. But Latinos are all of us that come from our languages come from the Romance Latin language. And so as being a Latina, I am Hispanic, I'm not. So you'll hear most of the time I'll use the term Latinos to kind of include everybody that speaks Spanish, but also those of us that speak Portuguese. Okay, so Latinos actually right now account for a little bit more than 13% of the total U.S. population, in which around 67-68% are of Mexican origin. Important to note is that the Latinos are now considered the majority minority, which is kind of an oxymoron, but all that means is just that there are more Latinos here in the U.S. As opposed to other minorities, which would be African Americans, the Asian, or any other population outside of the Anglo. Latinos are more likely to reside in the West of the United States and in the South, okay? But we have seen a tremendous increase in the number of Latinos that have moved here to South Carolina and the Southeast. Around 34% of the Latinos here in the United States are under the age of 18, so they're relatively kind of a younger population, and they account for half of the nation's population growth, and 47% are due to natural increase, which means then that a lot of the Latinos that are here now were actually born here. They're not the ones that have come or you know, that may come with visas or may come here as an undocumented individual. It means that they were born in this country, and that number has increased significantly, and we have seen that increase also here in South Carolina as you know, more and more Latino babies are being born. So in South Carolina, we have seen a very large growth of Hispanics in the past 20 years. Again, I've been living in South Carolina since 1972. And it's a long time, and I'm telling you, you know, it hasn't been till I can remember about 10, 15 years that I've really noticed an increase in Hispanics or Latinos here. When I first came, it wasn't that many Latinos here, and if you heard someone speaking Spanish, everybody tended to look and, you know, what's going on. And so, but now I think you're starting to see an increase of the Latinos here, and people don't look as much as we used to when you start hearing people speaking Spanish and now even other languages. What has occurred here in South Carolina, though, is that organizations weren't, and many still are not ready. When the Latinos started coming to South Carolina, of course, as they come, if they have health issues, you know, those can pose problems to public health. If they have, you know, they have to go to young kids go to school. You know, there's issues where, you know, police may be involved. And so what occurred when the increase in Latinos in South Carolina, when we started noticing, and it was putting some burden in a lot of our systems, educational system, the police system, or law enforcement system, as well as the healthcare system, we noticed that the organizations weren't ready. You know, because there was a lot of barriers, communication barriers, culture barriers, documentation barriers. So there was a lot of things that we noticed when Latinos first started increasing. And again, this resulted in many issues for healthcare, police, and the educational institutions. Around early 2000 is when we, those of us that are Hispanic or Latino, and that we, you know, have a degree, we're here legally, we, you know, work for an organization that either public health entity or other healthcare facilities, educational facilities, we kind of decided to look at what we could find out about the Latinos, kind of do an assessment, a needs assessment, because we knew they were here, but no one really actually, you know, looked into their needs, and didn't really do surveys or didn't anything with this population. Plus, this population really had a lot of issues with trust, right? They didn't want people to know they were here, many of them, and then they were always kind of that forgotten, vulnerable population. Well, around 2003, there was a study that was done, and it was with the families here, Families of Society or something. Sorry, I don't even remember the name, but it was done here at the University of South Carolina, and it was the first major questionnaire that was done for the Latino population in South Carolina. And so a lot of questions asked about their healthcare needs, about their educational needs. There's several demographic type of questions so that we could figure out here who's here, you know, what are their needs, and what's the ages, what's their documentation status, do they speak the language. And so as you see there, in 2004 was when this document was actually published, and it's the South Carolina Latino community characteristics that we found in this needs assessment. Around 2004, the average age of the Latinos here in South Carolina were about 30 years old, the median age of 28. Again, that tells us that they're relatively very young population here. 75% were employed. 87%, though, were uninsured. The average time in the U.S. was 3 years. 93% of Mexican origin, and 79% speak only Spanish. Now, this helped us a lot. Of course, we assumed that they were going to be uninsured. We assumed that many of them were going to be employed because, that's most of the reasons why they would come, and they work very hard. It's Hispanics are a population that work long, hard hours. They do everything that they can for their families to provide. But we didn't know that they were only here for a relatively short period of time. We didn't know that the majority of them were of Mexican descent. And that the majority only spoke Spanish. We assumed that some of them had actually started picking up some English if they had been here for a while, and so on. And so with us, especially in health promotion, education, behavior, knowing this kind of data helps us to be able to develop a more comprehensive program based on the years that they've been here, what culture of the Hispanic or the Spanish language they are. We knew that they were Mexican. We just didn't know what part of Mexico, because that right there can cause some cultural differences, and that they speak only Spanish. So we knew that even people who spoke a little bit of English or said that they did, we really couldn't rely a lot on that. So that's kind of what started it off, and this was about 2004. So after this needs assessment was done, some of you, if you're from South Carolina, we had a Democratic governor named Jim Hodges, sorry. Gosh, it's been so long. Jim Hodges. So Governor Hodges actually was at the time when the growth of Hispanics were increasing. And so he contacted the Commission for Minority Affairs, and that commission has a group or has people that work for various populations, like one works for Native American, one that works for the Hispanic Latino community, one that works for African American. And at this time, Governor Hodges contacted the Commission for Minority Affairs, the Hispanic section, and asked to do a major assessment of the population. Not only just healthcare, but he wanted to know about law enforcement. He wanted to know about employment, about educational system. And so that started when Governor Hodges kind of noted and that there was a need, and that was accepting. It kind of opened the door, and so we have come a long way from this time. So just a brief history, what we did, there were a couple of those of us that were contacted by the Commission on Minority Affairs and asked to actually help put together a report for the governor, okay? And so the committees were broken down into various ad hoc committees, in which the one that I participated in was the one for healthcare. And so if you see there, our task was to identify the barriers to delivery of services to non-English speaking Hispanic Latino population in South Carolina, and then to advise the governor. And so it was staffed by the Commission of Minority Affairs and the Office of the Governor. So this was around 2000 as well. There were 5 subcommittees, like I mentioned: education, healthcare, public safety, immigration, transportation, fraud, and human rights, which had a lot to do also with employment, because a lot of Latinos were getting not abused, but they were getting taken advantage of at work. And so with our healthcare subcommittee, we actually had a very large representation of people from throughout South Carolina that were either Hispanic or Latino, or worked for the Hispanic Latino organizations, or actually just cared about the community. And so there was a little bit more than 50 participants. They ranged from people from public health, mental health, other community-based organizations. There were a few Latino organizations. We really didn't have that many in South Carolina at that time, and we still don't now. Social service and faith-based organizations, universities, hospitals and clinics, private providers, insurers, and community members. And so it was a very large group that got together, but we knew that we needed to do this in order to kind of advise Governor Hodges of the situation. So the healthcare subcommittee we actually did, and I'm sure y'all have talked about this, but we did the nominal group process, and where we were able to kind of identify what our priorities were, because when you had more than 50 people in a room and we each had our own agenda and our own needs of what our population and our, in my area was HIV, and so I was all about HIV, and mostly in the Columbia area, and there were people from upstate, they had their issues, domestic violence, and so everybody came. You had your hospital folks that they came and they wanted about insure and all that. So we actually went through the process, and we were able to prioritize what the issues were of a lot of the barriers. And so our priorities at that time were language and communication barriers, cultural competency, and we said mutual competency because it's not only for the Latino community to understand the American way, or the health beliefs of the Americans and the way the American healthcare system is, but also for the Latinos to understand the American and the Americans to understand the Latinos. And so it was kind of went both ways. Access to barriers, lack of data for planning and surveillance. This was a big one because before we did the needs assessment that I was talking about, that it wasn't printed up till like 2004. So we really didn't know a whole lot prior to that. We couldn't find the information because a lot of the major organizations here in South Carolina, they used to put the Latinos or the Hispanics as others, and so we were always put in the other categories, and we knew that there were a lot more than the few, and so every time, and they were also not self-reported Hispanics. It would be people looking at them and saying, oh, they look Hispanic, and they would check them off, and they may not have been Hispanic, or they may have been Hispanic. So there was a lot of issues with the surveillance of the Hispanics here. Of course, immigration and social issues. And then, so what we did is we broke up those priorities, and we actually discussed each one of those, and we made recommendations for further action, and the implications if nothing is done, and the resultant actions. And this is kind of what it looked like. It was, as you can see, the letter up here is actually from the Commission for Minority Affairs, where it says, why this report provides information regarding the issues of concern to the Hispanic Latino community, inclusive of advisory recommendations from committee members. And so we actually did this very beautiful report to the governor. Each area did their own. Education did theirs. The law enforcement did theirs. And so we were, and this was provided to the governor, Hodges. And so that's when all this kind of started for us. Because after we finished that and we wrote that beautiful report that set up on his shelf, very pretty, it's probably still there. I don't know if, somebody needs to wipe the dust away and look at it. But so what transpired after that? We knew, especially those of us in the healthcare subcommittee, we said, there's a lot of issues here. We can't just write this report and then let it go and not let anything happen. And so we decided as a collective group, the majority of us, there were some people that didn't have the time or felt it wasn't the need, or we established a coalition, okay? And it was called the South Carolina Hispanic Latino Health Coalition. This was actually established soon after Governor Hodges' report, as a way that we could actually come together and be a voice and a force for our Latino communities in regards to healthcare. And so if you see here, this is kind of a little off, but this was what our mission of the South Carolina Hispanic Latino Health Coalition. It was to provide coordinated leadership and advocating for equal access to quality health care. We just wanted the Latinos and the Hispanics to have the same quality access to health care that any other population had, regardless of whether they're documented or not documented, because a lot of documented Hispanics that were here legally were still not having the best care. We wanted to set priorities for action in keeping with the national standards for culturally and linguistically appropriate services, the class standards. And this is something that came about, actually, it started in 97, but I believe that it actually became full force around 2004. And I'll talk a little bit about that a little further down, but this is a very important piece that, for the healthcare providers as they are providing care for this population, that they are culturally and linguistically appropriate, the services that they provide. And as you can see underneath here, this is just the first standard of the class, which talks again about how you should provide healthcare services to this population. These were our objectives. We had 5 objectives, but we wanted to make sure that we kind of covered all the areas. Our objectives were to improve communication among healthcare service providers, state agencies, and the Hispanic Latino community, because we wanted to make sure that everybody was talking to everybody, especially listening to the Latino community, because their voice was very important. We wanted to reduce organizational, systemic, and cultural barriers to healthcare. We wanted to promote best practices and cultural competency by agencies and organizations across South Carolina. We wanted to foster collaborative efforts and partnerships around specific issues of concern to the Hispanic Latino population in South Carolina. And we wanted to serve as a liaison and advisor to public and private agencies and organizations, especially as it relates to the Latino community and healthcare services. With this coalition, we actually became a 501c3 organization, a nonprofit organization. We actually had members. We had, it was really a great thing. And if you know about coalitions, when you're working in a community setting, coalitions is probably the best method that you can use to actually include the community themselves, but bring them together and to be able to provide advocacy and, address issues and where everybody is equal. Because part of our coalition, we did have those of us that were the professionals, they called us, right? Yeah, because it was like, well, we were professionals, but we brought the Latino community themselves, because they were definitely they had more to provide than we ever could. And we learned a lot more from them than they did from us. And we were just pretty much helping guide them through the process of what the needs are and what's the best way to address your needs. But as you look on this slide, these are some of the things that we did have as far as that we did for the coalition. We had monthly meetings. We had an electronic listserv. We had website. We did the La Vida Noticias, which if you look over here, this was actually done with partnership with DHEC, because DHEC was actually part of our partnership, our collaborators. And every month there was actually in Spanish, La Vida Noticias was a newsletter that we put in Spanish, all about different, health concerns in Spanish, written very low reading levels, so that the Hispanic community could, we passed it out at the end. There's in very different places where they frequent. And so it was a very, I think we did this for about 2 years. We had the HOLA newsletter, which stood for Hispanic Online Articles. Yeah, I know, came out perfect. Not HOLA, but HOLA. So we would also post things on our websites and send them out through our listservs of different articles of things that was going on. We did have an annual meeting, and we had a statewide conference that used to be called the Hispanic Health Conference. And we did it for about 5 years. And this was a lot of work, but we felt like we needed to let people know that the Latinos are here, and that we are, have needs that need to be addressed. This gorgeous person is me. Yes. I still look the same. Yes. And this was Dr. Deborah Parr Medina. She was actually one of the founders as well. But we developed leadership, because actually here I was the first president or chair of the Hispanic Health Coalition. And so here I've got, because there was a lot of leadership development, like I said, but we had developed bylaws, we had 501c3, we had a board, we had our strategic planning meetings, we had charter membership where people paid yearly or monthly. So it was, we were pretty together, yeah, for a bunch of Latinos, we were pretty together. It was surprising for, we were like, where? But anyway, so, And then we had partnership in action. So this was actually one of our meetings. As you can see here, this is when we start writing. You know, you're doing those nominal group and you know, Delphi and all that. We're writing stuff down as prioritizing. But we were getting to know each other and bringing other partners in. So when we would be in meetings, we'd find out things that were happening from each other or from the community, and then we would know who we needed to bring in to the coalition, or either as a presenter or as a member. We brainstormed about access to services. We identified gaps in knowledge and developed a research plan, because we ultimately wound up writing grants, and we actually received some grants through the Hispanic Health Coalition because we were a 501c3. So we wrote grants to do a lot of different programs for the community. And we also used to do cultural competency trainings where organizations would ask us to come, and we would talk about you know, working with the Hispanic community. We also did focus groups. As you can see here, this is actually a focus group that we did for healthcare perception and experience of Hispanic women. These over here on this side were actually the facilitators, because you did have to be bilingual. And then this was actually some of the focus groups that they would do. And we were able, so the coalition allowed us to actually do a lot more. And, you know, it's a great method. And then with that, some other stuff grew. I don't know if any of you guys have heard of FASUS, but FASUS is an organization that is actually here with through the Arnold School of Public Health, but they've been around for a while as well. And FASUS stands for STEPS. And so this is kind of how FASUS started. It's a very well-known organization now that does a lot of stuff for the Hispanic community. And so if you haven't heard of them, trust me, in your time here, you will, because they're, you know, premier Hispanic organization. But how this started, FASUS, in 2004, the DHECS, Division of Perinatal Systems and Palmetto Health, conducted a gap analysis on the maternal and child health needs of the Latino population in South Carolina. And so again, we started noticing, again, this is all starts in that early 2000s, that, you know, a lot more Latino babies were coming through, a lot more pregnant women going through the different clinics, and a lot more births. And so they did DHECS, Perinatal Systems and Palmetto Health, Richland, actually got together and collaborated and did a gap analysis to see what was missing. What they found is that the Latinos had great strengths, they have limited access and information about health resources, and that South Carolina's health system needed support to increase its capacity to effectively respond to the needs of its growing Latino communities. Again, found a lot of the same things that we did, right? In June of 2005, the actual organization FASUS was created. So it was just a year later after these two entities kind of got together and decided to do this gap analysis. And actually the executive director of FASUS was actually one of the people that actually helped do the gap analysis and the report after. But in 2005, FASUS was created from the funding from the Division of Women's and Neonatology Services of Palmetto Health and a community grant from the South Carolina March of Dimes. So what occurred is that after the gap analysis was done, and there was realized that there was a lot of issues, FASUS was actually created as a 501c3. It stayed with Palmetto Health Richland for a while, and it did receive money from them, and as well as some money from the March of Dimes to work with Latinas, I think in childbearing age, but pregnant Latinas as well. In 2008, 3 years later, FASUS initiated a partnership with the USC Arnold School of Public Health. So now FASUS is actually part of the Arnold School of Public Health. They work very close with our Consortium for Latino Immigration Studies, also at the Arnold School. And they receive numerous grants, to work with the Latino community. They have branched more than just working for pregnant Latinas or Latinas of childbearing age. They work with families. They work with, various counties now, and are always increasing. And so it's a great organization to to know and to work with. And so briefly, I just want to end with these kind of things. So I talked to you about kind of where it was when I first came here and how we've kind of evolved. We have gotten better. We really have. There's more professional Latinos here. There are a lot more people addressing the needs of the Latinos. There are people using, interpreters the way they're supposed to and all that. But there's still gaps and barriers to addressing our health issues here in South Carolina. And in, a few of them, I'm just going to mention a few. And so I found this that I thought was really good, and she talked about, biases and things like that, because, even with the new administration and our presidency and all that, it's bringing back a lot of these issues that we thought that we had kind of surpassed, and now it's kind of coming back. So fewer and fewer Americans today openly admit to having biased viewpoints or opinions based on race or other diversity factors. Race, ethnicity, gender, sexual orientation, abilities, disabilities, age, and religion are important components of who we are and what makes us individuals. And so this is just saying that, again, we had the issue of people, being biased against the Latinos that were here. You heard the president say some things that, based on what he believes and all that. And so that's kind of perpetrates more of that. And so with that, we did have issues in the beginning, where there was discrimination and certain prejudices and things like that with the Latino community, assuming they're all Mexican or they're all illegal and all that. And so this is still a major gap and barrier that we have to deal with working with our communities, okay? The mistrust. Biases, stereotypes, and prejudices is, it is only natural to develop filters based on our background and experiences, right? I mean, we all do that. These filters become the biases through which we see the world. They are natural occurrence and often so much a part of us that we don't even realize they exist, right? So we think things and we say things that to us feel so natural, but it's, based on what our experiences and our background. Biases are thoughts and feelings that we have based on belief system, values, morals, and traditions we raised with or exposed to in the past. And they're learned, so it's not something you're born with. They are learned. Stereotypes, however, are the application of biases to a group of people, and prejudice is actually acting on those stereotypes. And so when I look at this, and I put this here because, we had moved forward so much since the early 2000s, and now we're seeing an administration, not to say who's right or wrong, but an administration now that's kind of perpetrating some of those biases and stereotypes within certain diverse groups, and therefore it's actually resulted in us going backwards a lot in this state especially. Other gaps, of course, to addressing our health issues here of our Latinos is the immigration issue. Again, many may not be here documented, which means that now we are having issues where they are not seeking health care. Women that are getting pregnant are not seeking health care, and that's not good. We want the women to get their prenatal care. You have issues with, domestic violence where women aren't calling for help, or the men. So it's caused a lot of issues now where public health is it's not good for us to work in public health. Many organizations are still not culturally competent. As I travel, there's people they're not culturally competent. And then funding or addressing Latino health issues in South Carolina is limited. The funding, anytime you get a little bit of funding and anything gets cut, it's usually the program for Latinos that are cut. It's always been like that. It's something that we always fought about and thought, but it's kind of you have to cut somewhere, and so that's the easiest place to cut. And again, there's not that many Latino professionals in South Carolina, because I do remember that as a Latina in South Carolina, anytime an organization was needed somebody on their board to represent a Latino, they would call us. And so, we were to represent everybody, so we knew about all the Latinos, yeah. Whether I was Mexican, Costa Rican, whatever, it was like we need a Latino on board. And so they would call us and we would think, yeah, maybe we'll get a voice there. And then we would go to the meetings, and it was really just a token. We were just a token. They never really, followed up on what we needed or anything like that. And so it kind of got old after a while. And so what we would like, of course, is we greatly encourage that healthcare facilities use the culturally and linguistically appropriate services standards. And again, this was established around 1997. They started talking about it, and it came out in 2000. But it's a standard that's kind of came from the Office of Civil Rights, Title VI, that says that everybody is treated equally. And so, we push that. Why it was developed is because it's a means to correct inequities that currently exist in healthcare. It's intended to be inclusive of all cultures, but not limited to any one group. And it's designed to address the racial, ethnic, and linguistic needs of different populations. So that's what class standards are for. In any organization that gets federal dollars is required to do this. If not, they are mandated. If not, they can actually lose some of their funding. And this was actually the 2000 class standards. As you can see, there were 3 major themes, and some were mandatory that you had to do, and some was just highly recommended. But as you can see, there's 1 through 14. Now, actually, there's actually 15. So they've actually renewed the class standards by adding another step, which is great. The problem is that, again, nobody's really doing it like they're supposed to. We still have a long way to go. The entities that do not use the class standards risk losing federal funding, such as Medicaid and Medicare, but there's nobody policing them. Everybody has a million things to do, and we see it all the time that they're not using what they're supposed to be doing. But the Latinos aren't going to. They're definitely not going to report them because they're maybe here undocumented. They don't want any problem, and they're happy, with what they're getting. Immigration issues today is worse than ever. I've never seen it in my lifetime. What's going on now? Biases, stereotypes, and prejudice still exist. We see that every day. And there's still a limited number of professionals, Latinos in the state. We have had many Latinos that have come through the Arnold School of Public Health. However, the minute that they graduate, they're gone. They go somewhere else where they can make a lot more money, or a state that's a little bit more prepared to deal with these kind of issues. And so I kind of went fast. Hope I didn't go too fast, but thank you again for your time and attention. And I have no clue what to do with as far as questions, how that works. So
they'll pop up here. So I think, yes, Janet will shrink that for us.
Okay.
And so if you have questions, they'll either show up here or here, and we can see if they're typing. So class, I encourage you, if you have any questions, to go ahead and
speak up or type. That was excellent. I didn't know a lot of that stuff.
Oh, you're quite welcome.
Thank you. So I have one question. Sometimes it takes the class a moment to think. But I have one question. So if you are working in a community doing a community assessment, what would be the best way to make sure that you are including the Latino community in your community assessment?
Okay, so that was a great question, because with our community, especially now, if you're going into a Latino community and you want to work or find out, it's best that you work with an organization that already has built trust in that community. Not everybody can just go into a community and be accepted. I mean, even with me, if they don't know me, if I speak the same language, that doesn't mean that they're going to accept me. So the best thing to do is work with an organization that has built the trust. They already have their stakeholders. They have they know who's the community leaders, and that's kind of how that would work.
And how would you identify that?
Through, again, usually it's word of mouth, but like I said, PASUs. PASUs, everybody's heard of PASUs because they've done so much wonderful things, and they have so much trust and confidence in the community. And even if it's about an issue, if you needed PASUs to help you with an issue, that they know nothing, they don't know anything about, like, I'm just going to make one up, like prostate cancer, and they want to reach out, and you want to reach out to the Hispanic community, you go through PASOs, they can put you in, get that going. Because there's really not that many Hispanic organizations here.
Right.
It's starting to build, but the trust is what takes a while, especially now with the issues and things like that. So,
what about the coalition? Is it still
I
together?
forgot to tell y'all. Yeah, it lasted until last year.
Oh,
Last
really?
year because people, a lot of people moved away, and it was just a lot of work, and so they decided last year to do away with the coalition. But yeah, it lasted a good
Wow.
12 years, 13 years, and it was the first Hispanic health coalition here in the state.
Wow.
So yeah, I kept talking. We used to, but yeah, we're no longer.
Wow.
You know.
But still, that I mean, for
Yeah.
for a coalition,
Yeah, it was a long,
that's a long
yeah.
time. I see that Dom has questions. Can you read that?
Okay, so it says if someone wanted to direct an organization engaging in community health needs assessment for a community, whose contact info might we give them? So Dom, I'm assuming for the Hispanic health needs assessment, I would definitely again start off with FASUS, but there is an organization which I put on their website. But there's also some alliances that have been developed. One here in Columbia area, and there's one in the Greenville area. They're called one is Alianza Latina, and the other one I think is just the Greenville or Hispanic Alliance, because those are people who also have gained trust into the community and can kind of guide you the right way. But to get into this community, you have to know people to talk to them, and if you can get them on board, then they're more than likely to help you into the community.
Yeah, and I'll note that also on PASOS, I mean, they have promotores
Oh
or
yeah.
community health workers all around the state. So I think I mentioned this the other day that another reason to go through PASOS is to be connected with a community health worker in the areas you're working in. I mean, they're regionally based, but that's somebody who's very trusted in the community where they are.
Absolutely. The promotores or community health workers that PASOS uses, yeah, they are very, very valued and trusted in the communities. And I don't know, Don, you said because I'm currently looking at a CHNA.
Yeah, community health needs
Oh.
assessment done by actually a hospital, and that was
Okay.
our hospitals in the Tri-County, Dorchester,
okay.
Berkeley, and Charleston County, and that was an area that they didn't they recognized was a weakness.
In North Charleston, there are a lot of Hispanics in North Charleston, a lot. So community there, and so we know there's a need there in the North Charleston area. Well,
any additional questions? I don't see anybody typing any additional questions. Yeah. Thank you so much. We really, really appreciate it.
Thank y'all. Good luck.